Hi, my name is Olivia Barnes, and I chose to do gender inequality in healthcare for my oral presentation. So it's a no-brainer that there is discrimination, even in something so universal as healthcare. A lot of us probably don't see it or experience it. So the goal of this is to explore the inequalities in terms of cost and access to healthcare, specifically pink tax for women, and reproductive inequalities, and then also addressing the intersectionalities of um, being a minority and trying to get health care. Just some facts. 51.7% of females and 21.3% of males were negatively affected by gender discrimination. And it's typical that women get more attention due to having more severe reproductive issues, but they're still at a great disadvantage because a lot of times they're employed by jobs that have lower quality health insurance and treatment plans, and that's because of social standards that women's jobs are less demanding than men's jobs. So maybe they feel like they don't have to offer as much coverage as other companies. Members of minority groups are at an even greater risk of discrimination, obviously. And healthcare discrimination includes gender and sex, race, ethnicity, sexual orientation, and even socioeconomic status. So when I am addressing this pink tax, for starters, pink tax it refers to the cost of things that are targeted towards women over things that are for men. So like razors and shaving cream that says women's or for women is typically like $2-3 more than, razors and things like that that are for men. But when I am talking about pink tax, I am addressing the taxation of feminine hygiene products, which is a basic need for women. We don't really have an option. So only 15 states across the US do not tax these kinds of products, 5 of which have no sales tax at all. So if you don't include those 5 states, only 10 states across our country voluntarily remove taxes from feminine hygiene products, a necessity. Items such as chapstick, Viagra, dandruff shampoo, they're all on sales tax exempt slips, which is weird. So really, what's the big deal? Well, if you break it down, it results into about a woman spending an extra $318 as a bare minimum on top of what she's already spending. And fact of the matter is a lot of women, especially in lower socioeconomic status classes, struggle to buy these basic necessities for themselves. So that extra, 50, 60, $70 or 70 cents as tax kind of could possibly put a strain on them financially. So going from that to a little more into inequalities with women is reproductive inequalities. So having access to things like birth control. Failing to provide birth control coverage is sex discrimination because only people with female reproductive organs use prescription contraceptives. And there has been a recent Supreme Court ruling that actually overturned the initial requirement set in place by the Affordable Care Act that now is allowing employers to opt out of providing contraceptive coverage because of religious or moral objection. The religious part of it is understandable, even if we don't agree with it. It is understandable because that is infringement upon rights. But the moral obligation is very, very broad and offers rejection for something as far out as denial because the company just doesn't want women in their workplace. That's crazy. So it's just, why can that be an option? Why can that even be thought of as an option when it's discrimination? And then just stemming off that, um, birth control is also used as a moneymaker off the female body because birth control is pretty pricey. For if you take oral contraceptive and you have insurance, copay is typically still $15 to $50 a month. That's like $600 a year. But if you choose to do some other form of birth control, it could cost hundreds even with insurance. And then not to mention the cost of labor and delivery if you decide to have a child. That cost is between $5,000 and $25,000. These are moneymakers for healthcare because they're getting paid regardless whether it comes from an insurance company or it comes out of your pocket. Healthcare is making money off women by discriminating them for their bodily functions. So we're just going to jump right into minority discrimination. Discrimination based upon socioeconomic status, race, sex or gender, ethnicity. This goes against a moral pledge that healthcare providers commit to when they enter their profession. It sounds crazy, but it's not. They take an oath to provide to the best of their ability, and if they allow discrimination to come in, then they're not doing that. Just some things that are reasons minorities face discrimination is, first of all, the sex of a physician can determine where women of all kinds of ethnicities seek health care. Therefore, choices may be limited as a result of availability and location. A sex gender minority study revealed that those who identified as a minority experience daily discrimination within healthcare, and that led to higher feelings of anxiety and depression. And then research suggests that discrimination can be a daily experience for these individuals and lead to emotional dysregulation and psychological distress. And then African Americans and other vulnerable populations like Hispanics, whites of lower SES are experiencing striking health disparities. So it's bad to be poor in this sense because being on government funded insurance means that you're limited to where you can go. When I was younger, I was on Medicaid. So where I could go to the doctor was limited. Where I could go to the dentist was limited. My insurance would only pay for certain things. If they wouldn't cover it, it came out of my parents' pocket. And vulnerable populations are being represented by those populations that are not. And these discriminations are a combination of past and modern inequalities. These are 5 different examples of minority discrimination in 2 different studies that I found. The first one is from a black female, and she spoke of this account and said, they act like they're afraid to touch you or that they cannot tell you. They cannot see anything on you, and I have heard a lot of black people have issues about that, where they act like they cannot see anything on you, and a lot of time they will not touch you. The next one is of a black male, and he says, they saw me for the first time about a month ago. I always feel like I'm getting skipped over. I do not know if it's a black thing or not, but I always feel like I was here before somebody else and they went in before I did, but I sort of try to keep that to myself. The next one is about a gay man, and he was laughed at by a provider when he could disclose that he was gay. Another was a transgender HIV/AIDS outreach worker that they would not refer LGBT clients to the local mental health clinic because the counselors would just make them feel dirty and discriminate against them and judge them. And then one more was of an LGBT client in an area where she stated that a heterosexual healthcare worker blamed her for deciding to be in a same-sex relationship because asking other community members to accept her lifestyle was just too much to ask. After that encounter, the woman remained isolated from society and felt depressed, and she feared to seek care locally, but she could not afford to travel elsewhere for services. This is very eye-opening to see that these things happen. I'm from a very rural community, and I haven't physically seen this happen in my rural community, but to know that things like this are happening all across the country is just mind-boggling and baffling when these medical professionals are committing to provide service, yet they're judging and discriminating and doing their bare minimum for these people because they don't agree with their lifestyle, or they could be racist, but they don't say they are. It's just mind-boggling. So just in conclusion, discrimination is very real in healthcare, and it is everywhere, even if we don't see it. If you're a woman, you are inadvertently a victim of this discrimination because you choose to take contraceptives, or even one day you might decide to have children, and that makes you a victim of this discrimination. Gender minorities and racial minorities experience this discrimination possibly even more than others. And even people of lower socioeconomic status experience discrimination, and that's shown by how different healthcare providers can deny your service due to not being able to afford it, or your insurance, or things like that. Yeah, so thank you. And these are my reference slides.